In this video, I'm going to look at the reasons for shoulder pain. Shoulder pain is a common health concern often attributed to issues with muscles and bones. However, it's important to acknowledge that diagnosing shoulder pain can be complex, as it may come from different sources, including conditions related to the chest and abdomen. Diseases affecting the chest and abdomen regions can pose diagnostic challenges, especially when they coexist, making it difficult to distinguish between them. For example, individuals with existing issues in the bile duct system might experience upper abdominal pain during a heart attack. Similarly, gallbladder pain can manifest as referred pain in the chest or even the left shoulder, especially in individuals with a history of chest pain. This highlights the importance of understanding how pain can spread throughout the body. To understand the origins of shoulder pain, it's essential to examine the thoracic outlet. This anatomical area contains several critical structures, including the first rib, subclavian artery and vein, brachial plexus, collarbone, and the tip of the lung. Injury or problems affecting these structures can lead to posture-related or movement-induced shoulder and upper chest pain, categorized into various types, such as nerve injuries related to the arm, shoulder blade nerve issues, sudden inflammation of arm nerves, wrist tunnel syndrome, and damage to the radial or ulnar nerves. When assessing shoulder pain, it's crucial to distinguish it from issues related to the spine. If there are no signs of nerve root problems, the diagnostic process focuses on mechanical shoulder pain or referred pain. Mechanical shoulder pain can result from various conditions, including inflammation of tendons, inflammation of the fluid-filled sac near the shoulder joint, tears in the rotator cuff, dislocation, a frozen shoulder, or the rotator cuff getting pinched under the shoulder's tip. This pain often gets worse with specific arm movements and tends to be more intense at night. Orthostatic hypotension, characterized by a significant drop in blood pressure when standing, can lead to referred shoulder pain known as the coat hanger headache. This condition results from dysfunction in the autonomic nervous system and presents symptoms like feeling dizzy, lightheaded, and sometimes experiencing neck pain in the shoulder area. Understanding the connection between orthostatic hypotension and shoulder pain is crucial for effective management. Peripheral neuropathy can show up with sensory symptoms, including unexplained pain that may be felt in various areas, including the shoulders. It's important to recognize that these sensory symptoms should not be dismissed as originating from the mind and should be thoroughly evaluated to identify their underlying cause. Sensory disturbances can be challenging to diagnose but are crucial for identifying nerve-related conditions. Shoulder pain can be associated with lung cancer, especially when the tumor affects the upper part of the lung, leading to Pancoast syndrome. This syndrome is characterized by shoulder pain radiating down the arm, often accompanied by Horner's syndrome, a combination of eye symptoms. Understanding the relationship between shoulder pain and lung cancer is essential for early detection and effective management. Compression of the neurovascular bundle at the thoracic outlet can result in neurogenic thoracic outlet compression syndrome. This condition can cause shoulder and arm pain, weakness, and abnormal sensations. It's crucial to recognize that different structures can be affected, leading to arterial, venous, or nerve-related forms of compression. Identifying the specific type of thoracic outlet compression is crucial for appropriate treatment. Rotator cuff tendinitis is a common cause of shoulder pain, particularly in older individuals. Understanding the anatomy of the rotator cuff and the common tendons involved, such as the supraspinatus, can aid in diagnosing and treating this condition effectively. Recognizing the impingement syndrome associated with rotator cuff tendinitis is essential for proper management. Calcific tendinitis, characterized by calcium deposits within a tendon, can lead to sudden and severe shoulder pain. Inflammation of the long head of the biceps tendon can also contribute to shoulder discomfort. Being aware of these conditions, their typical age of onset, and diagnostic methods is crucial for prompt intervention. Shoulder pain is a complex issue with diverse causes, including orthostatic hypotension, peripheral neuropathy, lung cancer-related syndromes, thoracic outlet compression, and various tendon-related conditions. Recognizing the underlying causes and associated symptoms is essential for accurate diagnosis and effective treatment. Healthcare professionals must carefully evaluate patients presenting with shoulder pain to provide appropriate care and improve their quality of life. Spondylotic myelopathy is a common cause of chronic cord compression primarily affecting the elderly. It often begins with neck and shoulder pain accompanied by stiffness. As it progresses, bone and soft tissue overgrowth can compress nerve roots, leading to arm pain, often in a C5 or C6 distribution. In some cases, cervical cord compression occurs, resulting in spastic paraparesis, tingling sensations in the feet and hands, and diminished sense of vibration in the legs. Timely diagnosis through MRI imaging is crucial, and treatment options range from wearing cervical collars to surgical decompression for severe cases. Immune-mediated brachial plexus neuropathy (IBPN), also known as acute brachial plexitis or neuralgic amyotrophy, presents differently from spondylotic myelopathy. It often begins with abrupt, severe shoulder pain lasting days to weeks, limiting arm movement initially. As pain subsides, weakness and sensory loss become more apparent, with clinical findings depending on the affected nerves. Electromyography (EDX) helps confirm and localize the involvement site, and treatment may include empirical approaches based on severity and recurrence. Guillain-Barré syndrome (GBS) affects the peripheral nervous system and can cause shoulder and neck pain in its early stages. GBS is characterized by ascending motor paralysis starting in the legs and accompanied by tingling sensations. Severe cases may require hospitalization, and some patients may need ventilatory assistance due to autonomic involvement. After clinical worsening stops, further progression becomes unlikely. Shoulder pain can be a symptom of various medical conditions, including spondylotic myelopathy, immune-mediated brachial plexus neuropathy, and Guillain-Barré syndrome. Understanding the unique characteristics and diagnostic approaches for each condition is crucial for timely diagnosis and appropriate treatment. If you experience persistent shoulder pain or related symptoms, seeking medical evaluation is essential to determine the underlying cause and receive proper care. Thanks so much for watching the video. Like and subscribe.